Computer.
All right, hello everyone. Welcome to the Arizona Oral Health Coalition's Bite-Sized Webinar Series. My name is Tara. I am the chair of the Public Awareness Committee. I'm happy to be here today to present this bite-sized webinar. Our bite-sized series will consist of short webinars featuring the outstanding work of coalition members and individuals who work towards oral health equity. This October, we're pleased to announce a special series of bite-sized webinars that will be focusing on dental hygiene and medical integration. We'll be hearing from 3 dental hygienists who work on the cutting edge of this field. Today, in the first of our series, we welcome Michelle Gross-Panico, a dental hygienist with Dignity Health. Welcome, Michelle.
Hello, and thank you for having me. I appreciate this opportunity.
Of course, we're super glad you could make it today. And I think we're just ready to jump right in. Can you tell us a little bit about yourself and about Dignity Health?
Sure. So I have a slide to go along. I have some slides to go along with our discussion today. So if you do have a visual portion of this, you'll see on the screen a few slides that we have to share. For my introduction, I've been a dental hygienist since 2000, the year 2000, and I received my doctorate of health sciences in 2012. I also received a professional project manager profession certification in 2020 and decided to pursue this because I felt like it tied in with the work that I was doing in developing medical dental integration models. I'm currently the manager of the Community Oral Health Department at Dignity Health East Valley in Arizona. So that's Chandler Regional Medical Center and Mercy Gilbert. And I enjoy contributing to the state oral health advocacy and legislation through the Arizona Dental Hygiene Association for the last several years. I'd like to keep active and contribute in ways that I can for the legislation and advocacy.
Wonderful. All right, well, can you tell us a little bit about the organization?
Sure. The organization that I work for is Dignity Health. It's a nonprofit healthcare system. We were established by the Sisters of Mercy in 1854, a long time ago. In February 2019, Dignity Health did merge. We merged with an organization called Catholic Health Initiatives. And now together, after the merge, we have a parent company structure, and it's called Common Spirit Health. So Common Spirit Health is currently the largest Catholic health system and the second largest nonprofit hospital chain in the United States. So we've gotten very large, very fast, and it operates about more than 700 care sites in about 141 hospitals over and through and within 21 different states. We have a pretty strong mission to deliver compassionate care, quality care at affordable rates. We have a strong focus on serving the poor and the disenfranchised, and a lot of our work has a heavy emphasis on partnering with community partners to accomplish health. So we understand we can't do it all alone. So, and you'll see a lot of the community partnership theme that we do in the collaboration that we do in the community as we talk about our programs.
Great, yeah, I would definitely like to hear about those programs.
Yeah, so a few of the programs that we have in our department's called Community Oral Health Department. And the way I describe it is that we have 3 different programs that make up the department. So the first program that I'll outline is our children's dental clinics. We have 2, we have one in Gilbert and one in Chandler. And these dental clinics provide oral evaluations, prophylaxis, debridement, scaling, replaning, radiographs, dental sealants, fluoride varnish. We also do some minimally invasive care with silver diamine and interim therapeutic restoration. We have oral facial myofunctional therapy. We obviously give lots of oral health education. We work with families and patients on self-management goals. We have a strong emphasis on care coordination for any additional services that the patients might need, such as restorative care and specialty care. So those services that I list off to you are mostly dental hygiene focused or preventive focused. There's some that are therapeutic in nature, but all of them are within the scope of the dental hygienist. We employ the affiliated practice dental hygienist or the advanced practice dental hygienist So we can provide direct access to care. It's kind of similar in the medical model to like a physician assistant or a nurse practitioner. It's actually kind of a hybrid between the two of those. So it's our first program. Our second program is called First Teeth First. And this is integration at pediatric medical offices. We also go to OBGYN organizations and women, infant, children centers, the WIC centers. We also go to child care centers and community health centers. And when we're there, we're mobile. We go to lots of different community locations, and we provide dental screenings and fluoride varnish, anticipatory guidance, and also care coordination. They have a strong focus on helping the families get plugged into a dental home. Our third program and last program is our ICU oral care. It's an interprofessional collaboration model that we launched in the hospital. So this is more inpatient healthcare, inpatient patient care, versus our other two programs are more outpatient and out in the community. So our ICU oral care program, the services that they provide is they complete bedside oral evaluations, and they perform an oral care protocol, which includes oral cleansing with a rotary toothbrush, Biotene toothpaste, tongue scraper, and a Biotene mouth moisturizer. So in a nutshell, that's our three. I could talk all day just on that, but just in summary and as a high overview, those are our three programs that make up our oral health department.
Wow, those definitely sound like some incredible programs in that department. Would you be able to tell us more about the populations that these programs serve?
Yes, so our sticking to the theme of the three different programs that make up the oral health department, I'll start with the first, the Children's Dental Clinic. And at the Children's Dental Clinic, we see patients age 0 to 18 for new patients. And these patients, in order to qualify for our services, need to be either from a household with an income that is 200% or below the federal poverty level, or enrolled in a local, county, or state program such as Medicaid, WIC, or Head Start, or in a free or reduced meal school lunch program. For our First Teeth First program, our target population is expectant mothers and children age 0 to 5. And there are no income qualifications necessarily for the First Teeth First program. It's not stipulated in our grant funding. However, we do target low-income neighborhoods and organizations that are located in areas where we identify the population is struggling with receiving oral health services. In our ICU, ICU oral care program, we provide these oral care services in the hospital for patients that are age 18 or older. And that are not pregnant and that have an advanced airway. And when I say advanced airway, what I mean is a tracheostomy or intubated. So they're on some type of airway support. And there's no income qualifications for these patients because these patients are considered at high risk for ventilator-associated pneumonia due to their advanced airway, regardless, of their income.
Great. So yeah, I could definitely tell that your program works with so many members of our community in such a variety of settings.
Yes.
Yeah, in your work, what barriers or challenges have you seen that these patients can experience in trying to access care?
Well, we definitely do see a lot of families and patients with barriers. And as we all know, health equity means everyone has a fair and just opportunity to be as healthy as possible. But before a patient ever gets to our dental services, there are many factors that we have to consider that are going on behind the scenes or in the patient's lives. So a few of the barriers that we notice, and some of our families actually have multiple barriers, not just one, but I'll do just kind of a listing of what we see. Typically, we'll see low oral health literacy. We commonly see that both in our Children's Dental Clinic and in our First Teeth First program. We see no dental insurance, so cost is kind of a large barrier. So either they have no dental insurance or no means to pay. Often we see differences in language and in culture. So we often have non-native English speakers or non-English speakers. Completely non-English. And then also we see lack of transportation, just a challenge to get to the service. Also, some of our families have very rigid work schedules, so sometimes it's a hard decision for them whether to take a day off of work to bring their child in for their dental appointment, because it may put them at risk for losing wages for that day. Also, I would say difficulty finding a dentist. So if they do have some type of coverage like Medicaid, it's hard to sometimes for them to find a dentist that takes Medicaid, or even to find a dentist who's accepting new patients. So, and then not to mention, there's always that big obvious barrier of fear of dental procedures in general. So in the ICU, the barriers are a little different. Obviously, these patients are unable to seek oral care. So that's a huge barrier, just their medical condition. You know, they're unable to advocate for themselves. So.
All right, well, I could, thank you so much for talking about those. There's definitely a lot of barriers that can affect how people access care, and that definitely impacts oral health equity. So how do you and your program help overcome those barriers?
So the each program, it's a really good question, because when we designed the programs, that was our main goal, was, okay, how do we help this population achieve optimal oral health? And in order to do that, we really did have to take a long pause and take a look at why are they not, receiving services? And then once we identified that, we're able to identify, okay, how can we build our models in a way that helps them overcome those barriers? So I'll start again first with the children's dental clinics, because we noticed there was a lack of transportation for our families that receive services and need services. We located our dental clinics nestled in the neighborhoods. So we're not on the corner with a big sign, or, like a for-profit dental office would be, that's trying to attract a customer base. We're actually nestled in the neighborhoods. We're in partnership with the city of Chandler and the town of Gilbert at both of our locations. And nearby us is either one setting we're actually on the school district's property at Galveston Elementary School. And the other, we are located next to the town of Gilbert Senior Center and the Boys and Girls Club, and across the street from an elementary school. So not a highly commercialized area, just a neighborhood area, basically. So we do have several families that walk to their appointments, and so otherwise may not be able to reach us. We know if their kids are going to school and they're able to get their kids to school, they should be able to, in some way or another, be able to reach us too, because we're right there by the schools. So also at the dental clinics, the language and culture difference was very notable. So we decided to implement a different type of team model, and on our team, we decided to create a position for promotora. So we don't necessarily have dental assistants or interpreters. We have a Spanish-speaking promotora. Now, the hospital does provide us with technology for interpreter services. So if we find that some of our patients might speak languages that we're not necessarily able to speak, we can always utilize the interpreter services tools, which is very helpful often. But our promotoras are right there on site. And they are the ones that work with families. They talk with families. They do. They address low health literacy, which is one of the other barriers, through motivational interviewing, a show, tell, do model when they're showing different oral health skills, whether it's toothbrushing or flossing, and then also they work with the families to set self-management goals. So. How we overcome the barrier of how to find a dentist is that what we did is we deployed an affiliated practice model. So the dental hygienist can initiate care without the patient first having to have an exam by the dentist. We can just go ahead and give direct access to preventive care, which kind of makes sense, right? We want to prevent disease. So these families are able to get that direct access right away, right into preventive care. Our affiliated practice dentist is always available for consultation, and also through teledentistry if there's any case that needs communication. The last way that we overcome a barrier at Children's Dental Clinic is we are grant and foundation funded. So there's no cost necessarily. We know cost is a huge barrier for these patients. We really focus on the population that has no other means or has no other resource. So they do not have Medicaid coverage or access coverage. So if they do, we refer them to a local dentist in the area that accepts access and Medicaid coverage. But technically, we're looking to serve those kiddos that have no other, we're kind of the last resort, no other resources. So there's no charge to the family. As I mentioned, we are 100% grant and foundation funded. With the First Things First program, we recognize that lack of transportation is an issue for a lot of our patients. So our teams go out to the community sites. So it's a team of one hygienist and a promotora, and they go out to the community sites, and the community sites that they go to is pediatric medical offices, as I mentioned, WIC centers, childbirth prep classes, parenting classes, child care centers, community health centers. So we go there where we meet them where they're at. We recognize because sometimes the health literacy is low, they may not see dentistry as a priority. So we know that they are going to other like medical appointments at their pediatric medical office and such. So we meet them where they're at and then help educate them there. The provider type that we use is a public health dental hygienist, and there's huge emphasis for the promotora working with the families for care coordination. And I don't mean just referral, like here's a list of dentists you can go see, good luck with that. It's a more, we sit down with them, we make the phone call, we help schedule their appointment, help give them tips on how to be successful for their dental appointment. So some of that dental appointment etiquette and such. So the care coordination is a huge piece in helping them get plugged into a dental home. The ICU overcomes barriers by obviously bringing the patient service to the patient and kind of looking at care a little differently. We do this interprofessional medical dental integration model where the nurses and dental hygienists work alongside each other to take care of the patient.
Wonderful. Well, this is some incredible work being done to address oral health needs. Is there anything that coalition members or members of the community can do to support this work?
Oh, I'm so glad you asked. There's so much work left to be done and so much support to be given to these kinds of models that are really increasing the access to care and addressing those health equity issues. The first thing that comes to my mind is supporting any legislation, the Arizona Oral Health Coalition, the Arizona Public Health Association, and the Arizona Dental Hygiene Association typically work on legislation every year and advocacy. They have advocacy efforts that they dedicate their time and resources toward every year. So if you receive an email saying, oh, please click on this link, send a message to your senator or to your representative. I really wanted people to feel empowered to be able to do that. It's really quite simple. Oftentimes we provide a script that you can use if you decide to make a phone call, or even a script that you can use if you decide to send an email. But basically, our legislators need to hear from us because they often do not, as I've learned from interaction with them, they do not understand oral health. They do not understand the oral health system or why it's so hard to get oral health care for some populations. So please do see the toolkit that the Arizona Oral Health Coalition put out. They have some talking points and more information in there. It's in the October 2021 newsletter that just recently went out. So there's a little link on the PowerPoint. The federal legislation that's going forth now is for dental benefit to be put in Medicare. So this would be for our senior population typically. And this is called Medicare Dental Vision and Hearing Act of 2021. So you can either Google that or click on the link that we have in our PowerPoint. Also, Arizona Medicaid, like if we're looking at just the state of Arizona versus the federal movement, the state of Arizona, we've had a lot of advocacy around getting a dental benefit and dental coverage included for adults and expectant moms in the state of Arizona. So I think we've gone to legislation a few years with that. And I feel like each year we educate more legislators on the importance of this. So we're not going to give up, right? We're going to keep going for it. Sometimes it's just about educating, right? Increasing the health literacy amongst our legislators. So we will get there. And the last thing I would suggest is, maybe consider a career in public health. It's extremely rewarding, or at least I found it to be very rewarding. I used to be a clinical practicing dental hygienist in private practice, and I'm more in an administrative role now for the hospital. But over my transition in my years of my career, I have found it to be very rewarding to be in public health. So I would just encourage anyone to consider a clinical or administrative role in some type of public health setting or public health organization.
Awesome. Well, thank you so much, Michelle, for taking the time to talk with us about this amazing work being done by the Community Dental Health Department at Dignity Health. This type of community-based integrative work is so crucial for improving oral health equity. And yes, the coalition definitely encourages people to support this work through policy change and through getting involved in public health. So I really liked your action steps. Definitely.
Yeah, in conclusion, if anyone has any questions, comments, ideas, or just wants to hear about different career avenues, public health, feel free to contact me. I have my email address here on the website or on the PowerPoint, but it is, I'll also say it in case some folks are just listening auditorily and not visually. It's Michelle, MICHELLE .Gross, GROSS -Panico, PANICO, then the number 2 at dignityhealth.org. I look forward to hearing from you. And again, thank you so much for having me. This was really fun. I enjoyed.
Yes, thank you so much for taking the time to talk with us. It was really great to hear all about this program, and just it's very exciting to hear what's going on over there in Dignity Health.
Yes, indeed.
So if you're listening to this presentation on Facebook, you are welcome to leave a comment on the video and it will get its way to Michelle. But otherwise, definitely feel free to reach out. She left her email. But other than that, I think that wraps up the first installment of our dental hygiene and medical integration series. So we look forward to seeing everyone next week. We should have our streaming issues figured out by then. So awesome. Well, thank you so much. Have a great day, everyone.
Thank you. Bye-bye.